Hello, everyone. I'm doing my presentation on irritable larynx syndrome. This is something that we often saw at the Voice Center at Ashner, and it's not a voice disorder, but it is something that people often came into the voice clinic about. Irritable larynx syndrome can be characterized by chronic cough, excessive throat clearing, globus sensation, a feeling of postnasal drip. The term irritable larynx syndrome or ILS is given to patients that have no definitive etiology for these symptoms. Many believe there's a neuropathic etiology for ILS, just meaning that the larynx is in a hyperexcitable state, which leads to the symptoms of coughing and chronic throat clearing. Some common causes of ILS symptoms are sensory stimuli, such as a certain smell, LPRD, allergic reactions to pollen, grass, etc. Medications such as ACE inhibitors can cause chronic cough, and an elongated uvula was actually found to be a cause of chronic cough. Also, asthma and other pulmonary disorders such as COPD and postnasal drip or rhinosinusitis. These would all be known etiologies to cause ILS symptoms such as chronic cough and throat clearing. However, since ILS is thought to have a neuropathic etiology, the first step in diagnosing a true ILS is to rule out factors that could be causing the symptoms, such as GERD, allergens, medications, etc. In cases that have been unresponsive to standard medication trials, such as anti-reflux medication, nerve pain medication has been found to be successful in treating some of these symptoms since it has been thought to have a neuropathic etiology. So, medications such as gabapentin or amitriptyline have been effective in subsiding some of these symptoms, such as chronic cough and throat clearing and globus sensation in people with ILS symptoms. The role of the SLP in ILS is to improve the patient's voluntary control over their cough by teaching them to identify the sensations that come before the cough or the throat clear. We can teach patients ways to substitute a cough with a different response, and we can change the behaviors that are contributing to the laryngeal sensation of coughing and throat clearing to begin with. We can provide patient education about the negative effects that coughing and throat clearing has on the larynx. We can teach them that coughing and throat clearing is actually under voluntary control, and we can also teach them about the coughing or throat clearing threshold. We can also provide patient education on increasing hydration because that can lead to reduced mucus and globus sensation. We can talk to them about minimizing their consumption of alcohol and caffeine because we know these dehydrate the larynx. And we can reduce exposure to dry environments by implementing steam inhalation or humidifiers in the home. We can also talk to patients about decreasing mouth breathing and using nasal breathing instead, as this helps the larynx to feel hydrated. We can reduce exposure to laryngeal irritants, and we can also manage reflux, as all these things can exacerbate the symptoms of ILS. We can provide to patients replacement behaviors. So instead of coughing and throat clearing, we can teach them to use relaxed throat breathing, which is just using a breathing technique to reduce laryngeal tension, which therefore reduces the need to cough and throat clear. We can do pursed lip breathing, which is expiring through pursed lips, kind of like the size of a straw. So this helps reduce the sensation of coughing and throat clearing as well. Some other behaviors that you can do is just a nice hard swallow. So this interrupts the cough reflex and can reduce any excess mucus from the larynx. We can tell patients to suck on ice chips, as this helps with hydration and keeps the larynx from feeling dry or irritated. And then also sucking on non-menthol lozenges or chewing gum. Again, these are all ways to just help keep the larynx feeling hydrated and help to reduce that sensation to need a cough or throat clear. That wraps up this presentation. I hope y'all enjoyed it and learned something from it, and I hope y'all have a great day.